So you might wonder that what do you do if you experience these cognitive problems after a concussion? Well, there are several things to do. Number one, report your symptoms. Report them to your parents, report them to your teachers, as well as your athletic trainers if you're part of the team or if you're involved in a sport. Do not underreport the symptoms because it means that you have had a concussion and you're much more likely to delay recovery or to experience a second injury if you've gone back to activity too soon. There are a couple of important factors that you should consider when you're trying to figure out what to do when you have been concussed. Number one is do not isolate. Continue to engage in some type of physical activity. Continue to read, but at a much lower rate or lower volume than you did before the concussion, because we find that if you isolate and sit in a dark room and just wait for your symptoms to go away, they in fact go away at a much slower rate. However, if you continue to be active, if you continue to exercise your brain after concussion while taking care of it, your concussion symptoms might go away faster. Do not be afraid to re-injure your brain by continuing to read or continuing to exercise. You will not re-injure yourself. If you seek medical help, you will get advice in terms of accommodations. For example, if you're in the middle of your school quarter and you're about to take a midterm exam tomorrow and you were concussed 2 days prior, you might find that it's hard for you to study or remember any information for the exam. So you might need accommodations. So for teachers to know that they need to give you extra time to study or extra time to retake the exam. So please report your symptoms and consult with medical professionals.